Today we'll be demonstrating back strengthening exercises. As we know that backache is so common as a common cold and flu. So it has been said a person will suffer from a low backache at least 7 days in his lifetime. So common is the backache. Whatever the backache it may be, back strengthening exercises plays important crucial role in the treatment of backache. So if the back muscles are strengthened, most of the back problems can be solved. As we know, the backbone, the spine, which starts from the base of the skull up to the sitting bone, totally there are 33 bones with 23 discs. This forms the pillar of the body. On this pillar, we have muscles. So primarily these muscles are called as a paraspinous muscles. These muscles extends from the base of the skull down below up to the sitting bone. These paraspinal muscles are further covered with a superficial group of muscles like trapezius, serratus anterior, neck muscles, and also the rotator muscles of the lumbar region. So basically there are two types of exercises in the backache when we are talking about low backache region. One is forward bending exercises, another is backward bending exercises. The forward bending exercises that what we do is this, like bending forward like this, okay, and the backward bending exercises like seeing the ceiling or a roof. This becomes the backward bending exercise. So one exercise is called as a flexion exercise, that's a forward bending. Another, the backward bending exercises are called as extension exercises. So most of the time, the person who suffers from disc problem, slip disc problems, they will be benefited with the extension back exercises. Whereas the person who has got a spinal canal stenosis, who has got a facet joint arthritis, they will be benefited with forward bending exercise. Whatever it may be, to start with, first thing which we want to tell you is this: the back muscle, we have a paraspinal muscle like this. The person who has got a severe low back ache with a spasm of the muscle, first thing what they have to do is just keep a pillow underneath the thigh. So the pillow should be kept in a horizontal way like this, and make the patient to sleep like this. So once this muscle relaxes and knee goes for a flexion, our paraspinal muscle will relax. So whenever the person sleeps straight on his back, we can make a curvature like this. That curvature is called as lumbar lordosis. Once we put the patient in this position, this lumbar lordosis will get obliterated, relaxing your paraspinal muscles. So most of the backache with this position, almost I can say up to 50% of the backache can be controlled only with this position. Rest thing is other back strengthening exercises we'll be telling now.
The physiotherapy exercise for the back strengthening exercise is the first exercise: bend both knee and try to lift the pelvis. 1, 2, 3, 4, 5. Relax. So this exercise, first minimum 5 repetition to 15 repetition. Slowly you want to start 5, 7, 10, 15 repetition. Relax. You do for 5 times. In 5 seconds hold. 1, 2, 3, 4, 5. Relax. Now the second exercise, this two leg want to come this full side and the head want to come opposite side. And the leg want to come this side, head want to go that side.
By this, so we are putting in a torsion pressure over the SI joint, that's called a sacroiliac joint, and also over the lumbar spine.
This also you want to do for minimum 5 to 10 repetition. Straighten your knee, and it is possible. The third exercise, lift both together 15 degrees. Knee straight, 1, 2, 3, 4, 5, relax. Suppose the patient having any severe pain and not able to lift single leg. 1, 2, 3, 4, 5, relax. And that's it. 1, 2, 3, 4, 5, relax. And after 2-3 days, try both together. 1, 2, 3, 4, 5, relax. This level only want to lift down. 1, 2, 3, 4, 5, relax. And fourth exercise, bend both knee to the abdomen and relax. abdomen and relax, straight. Yeah. Straight. This is the fourth exercise.
See, once he bends this, okay, this is called as a bending exercises, a forward bending exercise or flexion exercise of the back. So most of the joints, facet joints will open. Those who have facet joint arthritis, who presents like this, in this way, when they get up in the early morning, they will have a stiffness. On doing some movements, okay, if they get up at around 7 o'clock, they will have a stiff back and a severe backache. By the time 10 o'clock or 11 o'clock with doing a movements, okay, they will feel much better. Those people who has got an arthritis of the facet joint and also spinal canal stenosis, they will be benefited doing this exercise.
And the fifth exercise is chin to the chest. 1, 2, 3, 4, 5, relax. So this exercise also it will strengthen the lower abdomen exercise and upper abdomen exercise. Last exercise is stretching exercise. Bend both knee to the abdomen. Try to catch with your hand. Try to catch with your hand and bring to the this one. It will stretch at the lower back. 1, 2, 3, 4, 5, relax. 5 exercise. It will helpful for the lower back, strengthening the muscles.
This about the flexion exercises. We have something called as a back extension exercises, where we'll put the back into the extension position. So normal spinal canal, what we say, okay, the diameter of normal spinal canal is around 13 to 17 millimeters. Once we put the back into the extension position, the canal diameter increases. This increases, in turn increases the blood supply to the canal and tries to clear out whatever the toxic material which are there inside the spinal canal. So here we are putting the back into the extension position. Okay. So once this head comes up, the body will go for a more of extension.
Yeah. First exercise, this is the first exercise. 1, 2, 3, 4, 5, relax. Able to see this muscle, it is going for the strengthening or contraction position. Second exercise, keep the head down, keep one hand up. Lift one hand up, 1, 2, 3, 4, 5, relax. And if you are, after 5 times, you want to lift this side. 1, 2, 3, 4, 5, relax. And if you want to lift to the lower limb without bending the knee. 1, 2, 3, 4, 5, relax. And right side. 1, 2, 3, 4, 5, relax. If you are practicing these exercise, then you go for the, if you are lifting your left hand, you want to lift to the right leg. 1, 2, 3, 4, 5, relax. 1, 2, 3, 4, 5, relax. You are able to feel this muscles, all muscles are going for the strengthening. Now both hand and both leg up, if it is possible. 1, 2, 3, 4, 5, relax. Head down. 1, 2, 3, 4, 5, relax. This is advanced, little bit advanced. If you are practicing that, you want to do that, and with the head also you want to do. Last all together. This is able to lift your hand also. So Superman position. This is, and if it is possible, next you want to do the plank. Right. So this is the plank position. It will strengthen all your spine, and the inside also. If you are contracting the muscles, there also we are able to feel the strength.
So these are the paraspinal muscles which runs along the side of your back. These are the paraspinal muscles. So this position strengthens your paraspinal muscles and also the rectus abdominis muscle, the obliquus muscles, sides this muscle. Right?
These all exercise, it will helpful for to reduce the pain, and the pain also it will not come back again. Relax.
So the extension exercises are very important, especially for those patients who are suffering from slip disc problems. So we always advise that patient has to go for a swimming, and swimming is the best exercise for backache problems. Once we do the swimming, our back will be put in an extension position. So it helps to increase the diameter of the spinal canal, in turn increases the blood supply and helps in the healing. So those who are suffering from the disc problem, they have to do the extension exercises more, okay? And those who are suffering from facet joint arthritis, spinal canal stenosis problem, they have to do more of a flexion exercises. So in a simple way, we can also make like this. If you have a disc problem, so this also called as sand beach position. Okay, how we relax in a beach. Okay, this is the one. Here also the spine is put into the extension. So what we call this position as a bhujangasana in our yogasanas, where we are putting in our back into complete extension.